So for the second segment on the leg, we're going to start with the back of the thigh and then work our way down the lower leg. So the back of the thigh, we've already looked at the quadriceps and the adductors. So the rest of the tissue that we see on the thigh is all going to be the hamstrings on the back. So we looked at quadriceps covering a big chunk of the front of the leg, this whole front side. The adductors covering this thin strip of the inner seam of the leg. Now the hamstrings are going to cover the rest of the thigh, really that whole posterior part of the thigh. So the thigh muscle, or the upper leg, is pretty straightforward. Many of us are much more familiar with the quadriceps and the hamstrings. But when we look at the hamstrings, we see a little bit of detail that we can kind of pay attention to, which can be helpful as a yoga teacher to understand. The first one we're going to look at is going to be the semimembranosus and tendinosus. The semimembranosus and tendinosus are going to be the medial part of the hamstrings here. So when we look at the back of the leg, and if you're sitting there, you can kind of palpate this really easily and just imagine if you grab your hands around behind the hamstrings, you've got one kind of group of muscles on the medial side and one on the lateral side. The semimembranosus and tendinosus are going to compose the medial side of the hamstring. So as I grab the inner part of the hamstrings, not necessarily the adductors, but the inner part of the hamstrings, those are going to be both the semimembranosus and tendinosus. So these are going to originate, in fact, all of the hamstring muscles are going to originate on the ischial tuberosity. In addition to one other group of muscles we talked about that also attaches to the ischial tuberosity. Maybe you remember the muscles we talked about already attaching here as the adductor group. We talked about one of the adductors coming all the way back to the ischial tuberosity. So we've got one of the adductors and we've got the hamstrings all connecting to this ischial tuberosity. Now the semimembranosus is going to cross the knee and it's going to insert right below the knee on what we call the medial condyle of the tibia. So if you look here at Fred's tibia, remember the tibia is this large bone of the shin and the lower leg. This condyle is just going to be this medial surface right underneath this plateau, this kind of broadening of the tibia itself, and it's going to insert right underneath that. So it's going to cross the knee joint, go from the ischial tuberosity to the knee. So it's somewhat going to cross the hip as well as the knee, meaning we're going to have two functions of this muscle, and of the hamstrings in general. The semimembranosus is going to flex the knee, right? We've got flexion of the knee here, as well as at the hip, we have extension of the hip. Now remember what it's assisting here, our primary hip extensor. Do you remember the name of the muscle that was the primary hip extensor here? The massive gluteus maximus. So the hamstrings will assist that. The gluteus maximus will be the primary hip extensor, with the hamstrings assisting that. You can imagine here, since they're coming from the ischial tuberosity down, its ability to extend the hip is going to be limited here. So it'll assist hip extension, and it's going to create knee flexion is going to be the primary move here for the hamstrings. So the big thing here that we want to think of is that these are going to be the medial hamstrings. So as we stretch these guys, what we're going to look at is two main scenarios where we see a hamstring stretch. So we're all pretty familiar with this idea that we're going to be stretching the hamstrings anytime we fold forward, probably. That's probably already pretty familiar to you, that forward folds are going to be the ideal way to stretch the hamstrings. But we've got a couple of different scenarios. We have forward folds where the legs are together and forward folds where the legs are apart. So we have Paschimottanasana, our forward fold with the legs together, and we've got Upavishta Konasana, our forward fold with the legs apart. So these semimembranosus and tendinosus muscles, which you can see in your manual where they are exactly, are going to be the medial hamstrings, and those are going to be stretching more when the legs are spread apart. And you can feel this if you come into Upavishta Konasana, the stretch more in the inner leg. And we talked about this also potentially stretching the inner thighs a little bit too, the adductor group. So we've got Upavishta Konasana stretching more of the semimembranosus and tendinosus, versus in a moment when we look at the outer part of the hamstrings being stretched more with the legs together. So poses to strengthen the hamstrings. Think about this similar to gluteus maximus, so bridge pose as I lift my hips up off the ground. looking at that hip extension capacity. Think about this also reverse tabletop, which will be similar in Purvottanasana, getting the hamstring activation as I lift the legs up there. Purvottanasana, as I have the legs straight, you'll feel a little bit more as I press down through the heels to really activate the hamstrings a little bit more than these guys, which we feel a little bit more in the gluteus maximus potentially. And then to stretch, wide-legged forward fold. So Upavishta Konasana is a great one for that. Now the next set of hamstrings that we look at is going to be the lateral side. So we've got semimembranosus and tendinosus, which are two separate muscles that are both going to come in a similar orientation here from the ischial tuberosity to the medial condyle. The biceps femoris, biceps meaning there's two heads. There's going to be a long head and a short head of the biceps femoris that are going to go, one of them from the ischial tuberosity and one from the shaft of the femur. Both of them are going to insert on the head of the fibula here. So kind of the mirror image of the medial condyle of the tibia. Now we're inserting just below the knee on the head of the fibula. So very similar again to the semimembranosus and tendinosus in that it's going to flex the knee and extend the hip. So similar poses to activate it, reverse tabletop, Purvottanasana, bridge pose. And now to stretch it, these forward folds with the legs together. So Paschimottanasana will be more targeting the semimembranosus. So you could also think about this in the context of something like Janu Shirshasana A, where I'm turning my torso forward. I'm going to be feeling this more in that biceps femoris versus coming forward here in Janu Shirshasana and feeling it more in the semimembranosus and tendinosus. So the important part of that is just to recognize that the hamstrings have several different groups. We have two lateral, two heads of the bicep, and two medial, semimembranosus and tendinosus. And so in order to stretch the hamstrings as a group, it is helpful to get different angles on the hamstrings so that I release different parts of them as well. So when we think of the hamstrings, we also want to think of them working with the quadriceps anytime I'm standing upright in this antagonistic relationship in standing poses and squats to some extent. So that one hopefully is a little bit more familiar to you. We've got the hamstrings on the back, the quadriceps on the front, the adductors on the inside. Now let's move down to the lower leg. And the main one specifically that we're going to talk about is the gastrocnemius. So when we look at both the forearm and hand and the lower leg and the foot, the musculature gets quite a bit more complex. So we're going to start to talk about these muscles a little bit more in generalities because I find as a newer yoga teacher or someone newer to anatomy, it's helpful to look at the big picture and the things that are going to be most relevant. And then you can add on some details here over time as you get more familiar with the anatomy. But again, we want to create a nice clear foundation to start with. So we're going to talk about the lower leg in a little bit more of a general sense. The one muscle we are going to talk about is the gastrocnemius. So this one's going to start superior to the medial and lateral femoral condyles here. So again, words that aren't really super important to remember, but to notice that it's crossing the knee and starting above the knee joint itself. So it's starting on the medial and lateral part of the femur here. And that will be helpful to know when we look at this, at the actions more of this in a moment and relate it to the other muscles around it. So the gastrocnemius will cross the knee. Then it's also going to turn into the Achilles tendon, which inserts on the calcaneus here. So the gastrocnemius is going to come from the femur, cross the knee, and the ankle to insert on the heel bone, the calcaneus, which is one of the tarsals we talked about, creating that Achilles tendon along the way. So we've got a couple of main actions here. Because it crosses the knee, it's going to assist the hamstrings in flexing the knee. And then it's also going to create plantar flexion of the foot. So I'm going to point the foot and flex the knee. So plantar flexion of the foot and flexion of the knee. Now, Activating this muscle really specifically in a yoga practice doesn't show up a lot other than in poses where we might lift up onto our toes. So you might take some variations in Tadasana. There's some great balancing variations just coming up onto the balls of the feet, maybe even coordinating it with the breath. I could do all sorts of different variations, even in standing poses, maybe lifting the heel to really activate this ankle portion of gastrocnemius. But remember that the upper portion around the knee is going to function similar to the hamstrings. So the same poses we looked at to activate the hamstrings are going to potentially activate the gastrocnemius to some extent. We see these a lot in athletes or sports that involve running because the calf muscles are so active in our gait cycle. So they tend to be a really tight muscle for a lot of people. And in yoga, we have a lot of great ways to stretch it. One pose in particular that we come to quite often, which is a great stretch for the gastrocnemius, is downward facing dog. So think about downward facing dog. We get both angles of it. Not only are we extending the knee to stretch the knee portion of it, but we're also dorsiflexing the foot to stretch the ankle. So we're creating both of the movements, both the movement at the knee and the ankle to create a really nice stretch through the back of the gastrocnemius. So downward facing dog is a great one. Another one that can be helpful is something like Paschimottanasana, where I am flexing the feet. And here now, I might move my emphasis from how far I fold forward and really take it more to the feet themselves so that I feel more in the calves, which might even mean backing off the fold and allowing the feet to flex more. You could do a similar orientation in Supta Padangustasana, where again, I'm less focused on how far I bring my leg into it and more on flexing the foot with my strap or my fingers so that I can really articulate the stretch through the back of the calf. In fact, you might even feel a stretch here as you come into something like crescent lunge as you push back through the heel. So there's several different scenarios in a yoga practice where we can get a really nice stretch for the calves here, for really specifically the gastrocnemius, which tends to be a tight one, especially for athletes, runners, people who hike a lot, or any sports that involve a lot of running. The calves tend to be a tricky one, so a really great way to approach it in a yoga perspective, simply through isolating or really pointing more toward the movement of the ankle in some of those hamstring stretches. So the next one I want to look at, and the rest of these I'm going to point out really briefly. So I'm not going to ask you these, none of these will be on your quizzes, but I am going to point out some of the muscles of the lower leg just to familiarize you with the terrain of the lower leg. So deep to the gastrocnemius, the next thing we have is the soleus. Now, the soleus is going to be similar to the gastrocnemius. It's also going to create the Achilles tendon. So it's also going to contribute to the Achilles tendon and insert on the calcaneus. However, it's going to start below the knee joint. So the differentiating factor here is that the gastrocnemius is going to be stretching as the knee extends, and I can start to target the soleus as I bend the knee and keep the foot in dorsiflexion. So if you imagine these two layers, and this is a really helpful thing to understand because the soleus and the gastroc get really tight, especially in athletes, maybe even athletes of shoes, people who wear high heels a lot. This can be a really big one as well. But think about something like broken toe pose. My knee is clearly not extending anymore, so my gastrocnemius isn't going to be stretching very much. Right? In order to really isolate the gastroc, I need to do both joints here. So I need to straighten the knee, extend the knee, and dorsiflex the foot. As soon as I take that out of it, as I start to bend the knee, I'm putting slack on the gastrocnemius, but I'm still dorsiflexing the foot. So I'm still getting a nice stretch now in the soleus and some of the deeper muscles that we'll look at in a moment of the calf. So a really important differentiation between the superficial calf muscle here of the gastrocnemius and the deeper calf muscles, none of which cross the knee joint. So by simply bending the knee and flexing the foot, I can target the deeper muscles of the calf. So I could do this in all sorts of different malasana variations here, not necessarily so much with the heels all the way on the floor, where you might not feel as much as of a calf stretch, but maybe with the heels reaching toward the floor, maybe with the arms coming forward, so that, again, I've got the bend in the knee, and I can really focus on that dorsiflexion of the ankle, which I could do with the feet together, or I could turn the feet out. There's a lot of different variations on malasana that I can use to work for ankle mobility, which again, as an athlete, is a really important thing to have for your gait cycle. And clearly just as a human being, because as human beings, we do a lot of walking and moving and running potentially as well. So next, what I want to look at in the lower leg is two categories of muscles. And we'll see a similar scenario in the forearm. So we've got dorsiflexion and plantar flexion. However, when we look at the lower leg muscles, on the front of the leg, we're going to see the extensors. And on the back of the leg, we're going to see the flexors. So don't let that confuse you with the plantar flexion and dorsiflexion, because both of them have flexion in the name. But the extensors are going to be on this kind of front side, and the flexors are going to be on the back side here. So we've got a couple of muscles, and I'm just going to go through and talk you through them really quickly. I don't want you to get too weighed down in the details of this, but we have a tibialis anterior and posterior. Then we have the extensor digitorum, which moves the digits. It's going to come all the way down to insert on the digits here. And the extensor hallucis, which moves the big toe. Then on the other side, we're going to have the tibialis posterior and the flexor digitorum, which again is going to come all the way down to insert on the digits, and the flexor hallucis, which is going to come all the way down to insert on the big toe. So for our purposes, it's helpful just to understand we've got these really important muscles here that are coming all the way down to the foot to articulate the toes and articulate the ankle joint, that are going to be this deeper layer of musculature. On the front side, they're going to be the extensors, which draw the toes and the foot back. And on the back side of the calf, we call these the flexors, which curl the toes and the ankle in the other direction. So flexors pull here, extensors pull here. And as a side note, the tibialis anterior and posterior are very important muscles that help to support the arch as well. But that's a deeper conversation down the road. Once you feel really comfortable with your anatomy, you can always come back and put in more information. So we've got quadriceps and hamstrings articulating that extension and flexion of the knee primarily, along with some other actions as well. Then we've got the gastrocnemius, is that superficial back muscle of the calf, flexing and plantar flexing, flexing the knee and plantar flexing the foot. Then the deeper muscles, the extensors in the front, drawing the toes and the foot back, and the flexors in the back, curling the toes and the foot the other way. And the tibialis, the tibialis anterior and posterior helping to support the arch. Great. Next, we'll look at the arm.